Now, the Health in the Public Interest Program is a one-year master's program that emphasizes the non-clinical determinants of health, social determinants of health, and today's seminar is going to be very much along those lines. You'll have a formal introduction of Peter Swenson in a moment. I want to mention a couple other things first, though. Farmed Out is having a conference that fits well into this topic, June 14th through 16th. It's in the chat. It's called, I've lost the chat. So Making Healthy People Sick. Here it is, Invented Diseases and Overtreatment, and it'll cover menopause, prolonged grief disorder, diagnosis of prostate and lung cancer, and a number of other things that are pertinent to the pharmaceutical industry's involvement in health. We'll have a panel of industry insiders and many other topics. And we have a sliding scale for registrations. Encourage you all to come. So just a quick word about how we run these seminars. I think everybody knows the drill, but we'll have Peter start with a formal presentation. Sophie is going to be the moderator. She's going to introduce Peter in a moment. After Peter's done with his formal presentation, we're going to have question and answer by seminar students first, followed by other participants. And I encourage everybody to be brief with their questions today, because we have a very large audience, which is, we're all happy about that, but we want to make sure that you all are able to participate. So with all of that said, Sophie, it's your floor.
Thank you so much. So I am here to introduce Dr. Swenson. Peter Swenson is Yale C.M. Sadin Professor of Political Science. He specializes in the comparative political economy of labor markets and social welfare in Europe and the US. He teaches courses on the economic, political, and social foundations of social policy and market regulation in developed capitalist democracies, with special focuses on healthcare and the environment. He's a two-time recipient of APSA's Mary Parker Follett Prize for the best article in politics and history for varieties of capitalist interests, power, institutions, and the making of welfare states in the United States and Sweden in 2002, and misrepresented interests, organized business, Medicare, and the building of the American healthcare state in 2019. He also received honorable mentions for APSA's Lubert Prize for the best book in comparative politics for the book Capitalists Against Markets, The Making of Labor Markets and Welfare States in the United States and Sweden in 2002. His most recent book is Disorder, A History of Reform, Reaction, and Money in American Medicine, published by the Yale University Press in 2021. This new book traces the political transformations in American medicine with extensive details on the dramatic conflicts inside organized medicine, as well as between the medical profession and society. These topics include, among other things, quality, equality, and economy in healthcare. It received honorable mention for APSA's 2022 J. David Greenstone Award for the best book in politics and history. And now for more of a fun fact. Dr. Swenson comes from a medical family. Both his parents, two of his brothers are medical professionals, but instead of thinking about cures for patients, he decided to veer off into political science and came to think about how to cure the world. And now covering this topic, maybe he's come home to roost late in his career with research more on healthcare and medical politics. And I am very pleased to present Dr. Peter Swenson.
Thank you, Sophie. So I'm seeing all of you. I guess that's I'm not so used to this. In a moment I'll share my screen. I've got a lot of slides, but first thank you for inviting me. I'm very pleased to be here with you via Zoom. I see a few people I've come to know in the course of my research. Hi, Joel Lexgen. I've already spoken with Adrienne, and I only see some of your names here. I should say, as I'll tell you, I'm currently working on another book, And I'd be very happy to hear from any of you now or later about if you can help me with data, with information about the things I'm looking into. So I look forward to meeting more of you. I'm coming to in June. I'm coming to the Farmed Out conference, so you'll see me there. So let me go to my slides. Share screen. How's that? Can everyone see?
Yes.
Okay, great. So this is a cover of my book. I wanted to call it The American Medical Disorder, but Yale Press liked snappier title, so it's just disorder. And so I deal with a lot of questions about, what is the disorder? What caused it? What perpetuates it? Who benefits? And how might it be cured? I have relatively little to say about that, unfortunately, how to cure things, because we're kind of in a rut for reasons I'll talk about. So let me figure out how to advance the slides. Oh, okay, good. So the root cause, that's what I'm looking at. Historically, it's of our disorder is politics, is the exercise of power, and in particular by the organized medicine, but with a lot of help from friends. Okay, and so you'll see these images again later. The biggest, most important results of this exercise of power is the United States being the only economically advanced country still without universal health coverage. And the AMA, I think, is the single most important factor in this, but it wouldn't have been able to do it without help, with considerable help. And I think you'll be surprised how much that the alliance with big pharma and currently the device industry, medical device industry, factors into the politics. Okay, so I thought it'd be a little entertaining to my mother, who's a nurse, public health nurse, sent me this once, and she thought it applied to me in a lot of ways. At the time she sent it in the 80s, I wasn't worried so much about the medical profession. I was more worried about her. She was climbing on the roof and in her 60s and cleaning out the rain gutters. So she clipped that out and sent that to me. She didn't want me to worry. But anyway, I want to tell you about first some about my current research and book before turning then to my disorder, and then coming back at the end of the talk to my current research. So the current book I think of calling Adulterated: The Bad Mix of Profession and Profit in American Medicine. A worrisome look at our current mess. So why do we need to worry about organized medicine still? Because so much industry money goes to the AMA and medical societies for a whole number of things. I'm sure a lot of you know about many of these things. It goes straight into the pockets of individual executives and leaders of the organizations. It goes in. It's extremely important in the running of annual meetings, symposiums, displays, and more. The offerings of continuing medical education that by law physicians have to attend in order to maintain their license, clinical practice guidelines, hundreds and hundreds of medical journals who are entirely dependent on industry money for advertising, as well as the publishing articles about research that's funded by industry. And finally, I think it's really important to note that pharma money it enables medical societies to offer relatively cheap benefits and services, discounted as it were. So membership dues don't cover costs. And in a lot of ways, members of medical societies are like me being a member of Costco. I get benefits and some cheaper benefits and services, whatever. And I'm not represented by Costco in any way, or AARP or AAA. I'm a member in a rather superficial sense, and I think that's true for many physicians. So in the past, the root of the disorder was the AMA Alliance with Industry and successful battles to control healthcare. And the present, AMA and over 300 now, and it's a staggering number to me. Local specialty societies and their charity foundations are heavily dependent on yearly infusions of cash, transfers of value, as it's called. And probably at least 50% of their revenue is directly or indirectly. It's impossible because it's well-kept secret. Nobody knows, nobody reports on the actual numbers. There have been some congressional investigations that have dislodged some numbers, and I'll tell you about that in a bit. Well, for example, investigations of the opioid crisis. The American Academy of Pain Medicine was an affiliate of the AMA and heavily subsidized by industry. Here is one. Purdue was not the only one, and you can see the figures are large. You can read these quickly, but you should be a bit surprised, I think, that Purdue money went into quasi-governmental institutions, which then in effect are part of the medical industrial conflict, the Federation of State Medical Boards that are involved in licensing, and the Joint Commission that accredits hospitals and other medical organizations. The Joint Commission, well, we can talk about that later at the end if you want to know a little bit more about why was a Joint Commission taking money from Purdue. Okay, so I had this from fairly good authority that probably over 50% of medical society money comes from industry, and this is a piece from 2008 by Lawrence Grouse, who's no longer with us, and indeed he confirms what I found out, that where the money comes from and for what is largely secret, especially as regards individual companies for individual services, events, and so forth that the medical societies are engaged in. And I found what he did. Now, this is just a small piece of a very large data set, a spreadsheet that I'm building with research help. And this just a piece at the end of it. These are a few of the societies. I put the pointed arrows at the dues, average dues, only because I wanted to compare that with what I pay as a member of the American Political Science Association, which is about the same, about $350 a year. And I think that's a lot. Physicians, doctors complain about their dues and they don't want to pay more, and the associations don't want to raise their dues because they're afraid of losing members. So this is why one of the reasons they're so dependent or have become dependent, addicted indeed, to industry money. So back to my book, How We Got Here, The Origins of Our Disorder. Now, a good deal of my book is in many ways a kind of antidote to Paul Starr's The Social Transformation of American Medicine. A lot of you, I'm sure, know of it, read it, or at least some of it, and we disagree on a lot. Okay, and a number of things. Like what is the disorder? How did it evolve? What have been the social, but also the political transformations involved. He talks very little about politics. The very source of medical power. He talks about medical power, but I think he's entirely superficial in understanding how medicine exercises power. And finally, the role of corporate interests in alliance with the exercise of medical power. So what is this disorder? One of them, which is a main important focus of my book, is public health, problems in public health. The Institute of Medicine says we have a public health disarray and put blame to a considerable extent on opposition, uneasy relations, confrontation, suspicion between organized medicine and public health institutions. So public health plays no role in Starr's book. And so here I have a number of slides I want to go through fairly quickly. This is a great depiction of how distinctly American our public our medical disorder is. And as you can see here, we spend far more per capita on healthcare, and with far less result, at least in terms of life expectancy. A lot of that, of course, has to do with public health conditions. And as I'll point out later, one of the great sins of organized medicine is sins of omission. That is not necessarily actions that are bad in themselves, but the neglect, the negligence, the failure to use their considerable power for public health ends. Okay, so here's an example of our the distinctiveness of our disorder. Much higher COVID death rates. The OECD, at which the U.S. funds with a lot of money, included the U.S. as close to the OECD average. I don't think that looks very close to the OECD average. I think that tells a lot. Americans, for a lot of reasons, are more likely to skip needed care. A lot of it having to do with the cost of care. We skip medications. Dramatically more often than other countries. Medical bankruptcy is a peculiarly American phenomenon. It's extensive. Well, a lot of it has to do with prices. Some of you know of and have read Uwe Reinhardt, and you may know this article, famous article. It's the prices, but he argues, or they argue, it's not so much the volume, because what we spend, volume times price, is volume times price, but it's not so much the volume of medical services and such, but the prices we pay. I think this is to a certain extent true, but also it doesn't tell the whole story. Physicians earn dramatically more, considerably more than in other countries here. Drug prices, on the right, we have US prices set at indexed at 100%, and here you can see great differences in prices. Not only drugs, but also many procedures, surgical and otherwise. So again, it really is a peculiarly American disorder. So where I differ, and I think there's a lot of reason for differing from Reinhardt's conclusion, is that, well, in general terms, the volume what's delivered in healthcare is about the same, but we deliver a lot more of expensive procedures, and often procedures that are unnecessary. I'll skip that for the benefits of time. This is an important Commonwealth Fund study that that looked at various dimensions or elements of healthcare in different countries, and the U.S. comes out looking pretty bad on most of the major categories. This is some of the, so this is, there's a genre of research which I find really important and intriguing. So I think this tells us it's not just public health conditions, it's also failure to avert death with quality medical care. Okay, so we're pretty low on the, very low on the rank from deaths due to preventable causes, but we're also very low on deaths due to causes that can be averted with timely quality medical care. Okay, so that's a good picture of how pervasive and extensive our disorder is. Okay, so I've decided to sort of structure my talks in part around my disagreements with Starr. And one of the things that Starr explicitly, or more or less explicitly, argues is that there's a great continuity over time in organized medicine as largely oriented to its guild interests, monopoly interests, income, and clinical autonomy. Whereas I found that's not true. Okay, the AMA early in the 20th century was a very progressive organization. Okay, and it just on many dimensions, and this just encapsulates those. Victor Vaughan was president of the AMA in 1914, and I think you can scan quickly the kind of things that were on his mind, and many of his fellow leaders in the top echelons of the American Medical Association. Okay. The editor of JAMA, the Journal of the American Medical Association, was a fellow progressive, and he was a fierce critic of the pharmaceutical industry, the emerging, growing, burgeoning drug industry. And much of the journal was had to do with criticizing the drug industry and trying to clean up journals, the AMA's own journal and the State Medical Society journals of specious, dishonest drug advertising. Okay, they were dependent on drug advertising back then as they were now, but with considerable success, the AMA cleaned up drug advertising in journals. Okay, well, in early 1920s, there was a dramatic, sudden reversal of the AMA. It was like a backbench revolt. It was a revolution inside organized medicine. And this is when AMA became a very reactionary organization, and it inaugurates decades of medical conservatism. And this is the kind of thing that a president of the AMA could say. Many of them were social Darwinists. Another example was I'm forgetting his name. My computer's blocking. Kosmak, an obstetrician who was an opponent of birth control, and this was some of the stuff he spouted as editor of the New York State Journal of Medicine. So if you're interested in the history of medical politics, my book tells this story of this flip-flop, this dramatic reversal. I've never been told before. I guarantee you, nobody knew. People like Starr thought there was a great continuity, and nobody knew why the AMA was so conservative and how it got that way. And so one of the chapters I'm particularly proud of is a very interesting and entertaining, dramatic story I tell. So this was Morris Fitchbein took over from JAMA in 1924 from the previous editor. I just had George Simmons, and in editorials in JAMA, he called the Social Security Act a horse laugh on scientific medicine and American patriotism, and many other things hostile to the emerging welfare state under in the New Deal. And he was a leading force in the AMA's vocal, fierce opposition to passing health insurance. Okay, so a lot of my books about what about what is medical power and how is it, what are its sources and how is it exercised. And Starr argues that it's plausible, but I think ultimately wrong, that the advance of medical science, biomedical science, was a source of legitimacy and power for the American Medical Association. But I think it's nonsense, because the AMA was becoming a powerful organization when the state of clinical science was truly abysmal. There were no great breakthroughs in clinical science. And what gained the AMA legitimacy early on, and I think the later AMA reaped the benefits of that, was its progressivism and public health reform and its battle against the drug industry. And its growing power afterward was the result of alliances with powerful economic interests, which I'll talk about in a minute. Some things that figure not at all in Starr's book. So the AMA was by the 1950s had a reputation for being far to the right of the mainstream American politics, including the Republican Party. So how was power exercised by organized medicine? Well, a lot of its success can be attributed to very successful public relations propaganda in fighting, for example, national health insurance. The use of paranoid rhetoric and reactionary and paranoid rhetoric. This is from that pamphlet, which described, and this is a quote from the president of the American College of Physicians, and so forth and so on. It is part of a deeper plan evolved by a few seekers after power, who under the guise of social betterment would change our democracy through the centralization of power and bureaucracies into a totalitarian government. Okay, so this kind of rhetoric goes on and on into the 60s. The AMA hired future President Ronald Reagan for, this was an LP recording of a talk or a speech he gave, and the final lines of that speech against Medicare was, "One of these days, you and I are going to spend our sunset years telling our children and our children's children what it once was like in America when men were free." Okay, I don't know if any of you remember this debate between Biden and Sarah Palin. She ended up with that very line of paranoid rhetoric. Well, obviously, the outward exercise of power included reactionary rhetoric, lobbying and campaign finance. The AMA was the most, for many years, the most the biggest spender in lobbying of all American interest groups. And here I'll just quickly give you one example back from the 1930s. The AMA chose the great neurosurgeon Harvey Cushing to advise FDR against including health insurance in the Social Security Act. Now, most of you probably don't know that initial thoughts about Social Security, about the Social Security Act, were, should we include national health insurance? And they dumped it because they were afraid of the AMA, that if it were included, the AMA was so powerful that it would bring down the entire New Deal, this big important piece of the New Deal legislation. And so Hence, that was one of those moments when we had a chance to pass national health insurance, which didn't happen because of AMA, powerful AMA. Something I talk about that's really important in my book is how the AMA exercised power, but a lot of it was by brutal silencing of internal dissent within the medical profession about the AMA itself, and criticism of American medicine as it was practiced and as it was distributed. And it was brutal. It was very dangerous for a physician to speak out. One of the things for interesting, complicated reasons, you could lose your hospital admitting privileges if you were expelled from your county medical society for deviating from the conservative political line of organized medicine. The EMA made a powerful example of this by smearing John Punnett Peters, who's a great clinical scientist at Yale. Peters organized a committee of physicians for the improvement of medical care. The group and he were vilified as an enemy of the profession for criticizing the low quality and lack of fairness of American medicine. And Peter, and I went through Peter's the papers in his archives at Yale. He was also critical of the AMA getting in bed with the pharmaceutical industry. How am I doing for time? I have till 10 more minutes, right?
Yeah, that's about right.
Okay. Well, I thought, so this oppressive climate in outside organized medicine dissipated to a considerable extent, especially after the AMA's defeat in 1965, defeat of its in the Medicare battle. It wasn't really a defeat, as we'll see. But anyway, so Jerry Cassira, some of you might know or know of, after he was fired from the New England Journal of Medicine, which was the property of the Massachusetts Medical Society, he wrote this really important book, some which I draw on for my current research, called On the Take. I highly recommend Cassira's book. So finally, differing from Starr completely ignores the role of pharmaceutical industry in the exercise of power and the transformations in American medicine. So in my analysis of the physicians are a small number of, they're not a big voting bloc. Organizationally, they're very wealthy and powerful, but also cannot exercise power without alliances with other economic groups. And I bring up agriculture, especially tobacco interests in the South, was extremely important for the conservative AMA, along with the pharmaceutical industry, and that extended even into the 60s. Some of you older members of the audience remember Drew Pearson and Jack Anderson, investigative journalists, and so really one of his stories about lobbyists. And this is a time when the AMA was the biggest spender of interest group lobbyists, and they had an alliance with the tobacco industry. And one of the things they delivered for that alliance was serving as a merchant of doubt about the dangers of tobacco and smoking. That's well into the 60s. And this was a lot about the importance of the alliance with its tobacco states, the Southern Democratic Jim Crow South. So I showed you this pamphlet before that it was produced by the so-called National Physicians Committee. About 90% of that so-called Physicians Committee funding came from Hoffman LaRoche and other huge drug corporations. So it wasn't really a physicians committee. Morris Fishbein was good friends with Elmer Bobst, an anti-Semite, ironically. And Bobst was a mover and shaker in this alliance. So in the 1950s, the AMA and the drug industry become fully enmeshed. There's a revolving door between the two, mostly a revolving door that goes from the AMA into the PMA, the Pharmaceutical Association of America. Austin Smith was Fishbein's successor, and he was rewarded the presidency of the PMA. And then Smith moved on to Park Davis, and PMA replaced with Joseph Stedler, America's AMA's executive vice president. So really, this is the American medical industrial complex where AMA is completely in bed with the pharmaceutical industry. The AMA, the journal, drops its quality control on drug advertising that Fishbein's predecessor had established with the AMA's Council on Drugs, and it became became entirely indiscriminate in what kinds of, well, not, I don't know how entirely indiscriminate, but very indiscriminate in what kinds of advertising, drug advertising, were allowed in the journal. In 1962, the AMA joined the pharmaceutical industry in opposing the Kefauver-Harris amendments, which now, with the origins of the requirement that drug companies run studies that demonstrate efficacy as well as safety. And this was the argument that the chairman of the AMA Board of Trustees made in testimony to Congress, that individual physicians don't need help deciding what works and what doesn't. They talk to each other, they read journals, see drug advertisements. They don't need the government helping them decide what's good and bad. So the fight against Medicare was largely bankrolled by drug industry. Okay, so 5 more minutes, see what I can do. Back to the present. So the book I'm working on takes off sort of where my previous book left off. One of the reasons I'm doing is this. Jerome Cassirer told me that, and I agreed with him, that I didn't have enough on the drug industry and its role in the. So in my book I cover up to what I call the present, but it's discussion of the role, especially of the specialty societies, as probably now the more important part of the organized medicine than the AMA itself. Now, and the AMA now, about 125 specialty societies have voting power in the AMA. So when you think of the AMA, it's not just the state and county medical societies in a pyramidal structure, it's also a federation of specialty societies. So why should we worry about this dependence of organized medicine on industry? Well, as I said in the past, obstructed national health insurance and making sure that legislation that did pass, Medicare, for example, served guild interests as well as pharma interests. I don't have time to talk about that, but I think I may have a quote from Fishbein about how that the medicine snatched victory from the jaws of defeat in the actual design of Medicare. More recent, pain societies conveying bogus claims that opioids for pain don't lead to addiction. And another example, I think extremely well documented, including in Senate investigations, that the American Psychiatric Association, which creates the DSM categories, were well integrated and entangled with pharmaceutical industry. So emission, commission, emission, and facilitation. Well, I'll skip emission for now. Facilitations, medical societies, and as enablers. Okay, so not necessarily committing crimes themselves, but providing respect, lending authority, offering prestigious platforms, venues, events for advertising, justice, education. This is a book by this article on a book by Richard Smith, who was editor of British Medical Journal for 25 years. Someone can tell me why the British Medical Journal was so deviant in many ways, in terms in its the kinds of articles that it published. But this is what Smith wrote in PLOS in 2005, and I forget what year this his book came out. Back to Cassirer, enablers, meetings. I'll let you read that. I'm losing my voice here. The creation of clinical practice guidelines, a lot of which are promulgated by the medical societies, especially medical societies. And this excellent quote from Marcia Angel sums it up quite nicely. A book that came out just about the same year that Cassirer's book, 2004 or 2005. A big thing, continuing medical education. All the medical societies sponsor CME events, which are heavily subsidized by industry. And this is really an interesting find that will be in my book. Okay, so many of you know about the open payments, which where you can look up any physician in America and find out how much they're supposedly receiving from industry. You just type in your doctor's name and you find out. Well, the issue has come up. Well, why don't require the industry and medical societies to report the transfer of money, the transfer of value, the flow of money into organized medicine? And this CMS was busy deliberating and crafting new regulations that would institute that, and organized medicine circled its wagons. About 100 medical societies, especially the MA plus specialty societies, plus practically every state medical society signed a petition, a letter to Wisconsin ultra-right Republican John Barrasso, who proposed an amendment to a piece of legislation that specifically prohibited CMS from gathering data and reporting on the flow of money into CME, but in particular, they were particularly worried about exposing this transfer of money. And their argument, preposterously, I think, is that it would chill the dissemination of a good and actionable clinical information that had undergone independent review in peer-reviewed journals, which is what they're referring to. But of course, we've already heard about the questionable nature of. Finally, sins of omission, and I'll try to make this quick. I think this is really important. What does industry buy? What does it get? Well, you've seen some of what it gets, but I think an extremely important thing is it buys silence. It buys inaction. It buys negligence on a lot of issues. And so organized medicine's dependent on politicians, Democrats as Republicans, for a lot of laws and regulations favoring the guild interests, the economic interests of physicians and their privileges. Economists call this monopoly rent seeking and extraction, making sure that the medical profession gets its cut. And last but definitely not least, negligence on matters of prevention and public health. So in short, organized medicine is an extremely powerful force. And this is let me see, the number of lobbyists, 50, this is just the AMA, not counting specialty societies and other of the 300 or so medical associations. Total lobbying spending in the millions every year. And this is really striking. The top spenders among trade groups: American Hospital Association, American Medical Association, Pharma, Blue Cross Blue Shield, General Electric, which is an important device maker. And that's just the AMA as among medical associations. In the spreadsheet, I don't think I show it, but I'm collecting data on their lobbying of all the associations and the number of lobbyists and how much they spend on lobbying. Sins of omission. I'm just going to, it's very difficult, and even the members of the associations don't know what the medical associations are doing in their lobbying activities. They pass a lot of wonderful progressive liberal sounding resolutions in the AMA House of Delegates. But what they do in lobbying has, as far as I can tell, nothing to do with the wonderful resolutions that are passed by the medical associations meetings and so forth. So just this is an incomplete list of things that I think organized medicine could but doesn't use its power for the sake of reform. Eliminating waste, passing national health insurance, which would reduce the administrative costs, one supposes, and finally, public health prevention, neglect of public health, and this is just a partial list of. You can read that very quickly. Okay, I'll leave you with this, and we can. So what could we do? Well, since the exercise of power got us where we are today in terms of the American Medical Disorder, it really, you can come up with all sorts of plans and ideas for what we should do, what we should change. But in the end, getting change involves the exercise of power, the shift in the power resources, and I believe that organized medicine should be, and potentially, and this is perhaps pie in the sky, could become a force of progressive reform, using its considerable power to make up for its sins of omission, commission, and facilitation. Okay, I'm happy to take questions or observations or suggestions, advice.
So while Sarah signs on and unmutes herself, let me just say that we're going to start with questions from students, and then we can expand to the greater audience. Peter, thanks so much for a compelling talk today. If you're interested in this topic, folks, I've reiterated in the chat the PharmDoc conference, which is going to be on a closely related topic. I also mentioned that student research abstracts are being accepted for a competition. So with that, Sophie.
Of course. Yes, so we'd like to ask the HAPI seminar students if they have any questions for Peter.
I guess I said it all.
So I see Brian, one of our students, has a question.
Hi, thanks for this presentation. This is really interesting. You talked about agriculture, the alignment with agriculture, but you only really got into tobacco. Are there other ways in which the medical industry is aligned with agriculture? I mean, I'm thinking, like, I've always thought there's this great loop, and by great, I mean great for making money and horrible for everything else, of our food industry making us sicker and our medical industry getting paid to get us healthier, like diabetes and stuff like that. Are those the sorts of connections you're thinking of?
Yeah, a good question. You know, I think it's a lot of scratch my back, I'll scratch yours. Sort of alignments of convenience. I need the votes for what I want in Congress from people that listen to what you say, and those who listen to what I say will help you. Okay, so that's just a general impression. So if you talk about food, you know, food insecurity, food deserts, reform in those areas require action by, let's face it, Republicans. And organized medicine does not want to anger Republicans, powerful Republicans, committee chairs, whatever, senators, congresspeople, because they want goodies from lobbying and campaign donations from those people. So if organized medicine were to take on a progressive position on issues, you know, the food and agriculture industry that make politicians angry, it's going to come back and bite organized medicine in the face. So that's a kind of general perception. I don't have any specific knowledge about particular issues. And again, what the AMA does in lobbying is just totally obscure. Nobody knows, and the AMA members I've asked don't know what's being spent on their behalf with their money, with in their name. It's just not reported. And it seems the members, again, as members, I'm a member of Costco. I really don't care and don't pay much attention to what Costco does and it's lobbying for its interests. So I hope that's, I mean, could be very interesting research, but very hard to research.
Thanks.
So I'm sure our students have some questions that they're percolating. Peter, let me ask you a question while we wait. I mean, do you think it's kind of a two-way street regarding the changes in the AMA and the kind of people that end up trained to be doctors? I mean, so on the surface, it looks like, you know, we try to hire people who are, you know, out for helping their fellow man, et cetera. But, you know, somehow, okay, this is just me talking, we end up with a lot of people who belong to country clubs and live in wealthy neighborhoods, et cetera. Is it a kind of self-perpetuating thing there?
Well, it was for many years, but it's changing now with the demographics of the medical profession, the younger, more female. So I had a slide. I don't want to pull it up now, but a few years back, the AMA House of Delegates came close to voting for single payer. Okay, you know, within a stone's throw, maybe 48%, or for single payer, and in particular for, and it had the effect of the AMA having to pull out of it. It's an alliance that was, of economic and other interests that were fighting against a single payer system. So, and as I said, there are a lot of idealistic, younger, female, Black members who finding their way to the House of Delegates. I don't know about other the meetings of other medical societies, who are passing great resolutions about health equity and so forth. But what does the AMA do? Is the question. And so the AMA. So here's an interesting thing I found. Probably a majority of medical societies do not have democratic processes. That is like the House of Delegates, where they come and meet and vote on resolutions and accept reports. It's entirely oligarchically run by executives, full-time executives, and presidents are only presidents are elected, but they have 1-year terms, so they're relatively powerless. Sometimes a fairly progressive or reformist type president gets elected, but that's not very common. They're not very active. They're not powerful, and they go away. And mostly who gets nominated and elected as president is engineered by the the oligarchy, if you want to call it that. So things are changing, but maybe superficially. So at least, and I've been told this is pie in the sky. At least there's the potential for change in the AMA in particular. But I think I have doubts about the specialty societies, which are politically, economically now, I think, more important than the AMA itself.
Thanks, Peter. Just real quick, do you have any idea what the membership of the AMA is and what the number of physicians out there is in the US?
There's close to 1 million active physicians, including osteopaths. The AMA is very secretive about its membership numbers and percentages, possibly somewhere between 15 and 25%, but a lot of those members, including members of specialty societies, are young. They have graduated fee dues rates, and medical students and residents and interns get in virtually free, and they're enticed into membership because they get cheap licensing, training for their licenses and so forth. So their figures are inflated, but I would say 15, maybe 10 to 15% of 10% maybe of active physicians might be realistic, maybe a bit more. It should be more, but they don't want to raise dues. None of these associations want to raise dues because they lose members, and they're addicted to the drug money, to do all the things that they do and to pay the salaries of the executives. I'm coming across as maybe more harsh than I should be, but so there are people who argue that it wouldn't be bad if organized medicine did less. What would be the cost? What would be the damage done if they gave up the money, raised their dues, and did less for the members, and did things that actually might represent the political leanings of the members? So the medical profession is becoming more liberal, but are completely in the dark about what their representatives in politics are doing with in their name.
Yeah, thank you.
Thank you. And one more question from students. I see Ella, you have a question?
Oh, yeah, it was just on that last point. I feel like a lot of physicians who are advocating on maybe some more progressive ideas seem to be overshadowed or not listened to. When you have the AMA who's not standing behind them, we deal with this a bunch in Tennessee with like Medicaid expansion or mask mandates in the state. And it's like, if there's not money behind it from the AMA to lobby them on these positions, then legislators often don't answer. More of a comment, but wanted to add that. And have you speak to that. Yes, thank you so much for your talk.
Yes. So next we can hear from Mr. Courtright is top of my screen.
Hi, this is David Courtright. Thanks for the great talk. And can you tell us where private foundations fit into this story? I certainly understand how JCO and FSMB take pharma money, for example. But what about something like the Robert Wood Johnson Foundation? Why isn't that more of a progressive counterweight? Or maybe it is a progressive counterweight and it's just not strong enough.
So a lot of the data I'm collecting is about medical societies' own foundations. Okay, they have their own, a lot of them have their own foundations, and I would guess that the money they get drowns out the money of more progressive groups, the American Public Health Association in particular, for example. But let me give you an example. The American College of Cardiology has its own, it has a foundation that receives, I mean, it's not just, doesn't have just a large endowment, it receives yearly millions of dollars. Okay, and where from? Well, individual donations for sure, but they have business, and they're on business money too. So if you combine the American College of Cardiology as the association and its foundation, I would say their membership dues represent more like 5%. You know, I'm these aren't exact figures, and I'm still processing these figures, but there are dozens and dozens of medical society foundations that are involved in advocacy, but also charitable work, research-related work. But I mean, I showed you that slide about what lobbying expenditure and the AMA plus other elements of the medical industrial complex just are gigantic compared to the forces for reform. And you know, they're political. They have lobbyists. I don't know if the Barbara Wood Johnson Foundation has a political action committee and has full-time professional lobbyists in Congress. I just don't know, but I suspect not much of, if any, of that.
Do you know if those societies have been co-opted by pharma?
Well, yeah, if you ever forced to give a yes or no answer, I would say yes, in a lot of ways. I mean, so we have there are historical instances where medical journals have been punished for publishing unflattering stuff by industry advertisers. That happens, and it's a threat. Okay, it's an unspoken threat, and so remember what Richard Smith said, the editor of former editor of British Medical Journal, that the journals themselves are marketing arms of it. So one thing I'd like to say about my research is, you know, I'm not a physician. I don't have medical training, so I'm really dependent on and it's really important for me to rely on material coming out of the medical profession, critics, medical critics who are prominent, respected, outstanding luminaries in the medical profession. Jerome Cassura, for example, among many others. So I want to have some authority or authenticity, and I don't want to rely. I want to rely on authorities within the medical profession who are outspoken. It's interesting. So one thing that's a good development since the days of the reactionary and ultra-conservative AMA is that the suppression of dissent is much weaker. There's less. There's much less punitive resources of being exercised against critics of American medicine and organized medicine in particular. So we see a lot of outspoken critics. It's not very well funded, as farmed out. Is I learned is had a infusion of money because of a litigation on a settlement, but the critical forces are impoverished relative to the organized medicine, and it's what it represents.
So just in the interest of time, we should probably move on. Thank you so much for the answer. Ms. Stanfield?
Hi, thank you. And Dr. Swenson, I'm sorry, I was late. I had an departmental meeting. I really appreciate your work. And of course, I have Engel's book and a number of them. I'm a total outsider. I'm a history professor, a Dalcon Shield survivor. So I started learning about medicine and big pharma in the 70s and pulled back and went my separate ways. And I wonder today about the issue of consensus around so many of these declarations that we have. I mean, I'm aware of retractions in the Lancet and other magazines, but what about public health? Once the vaccine consensus came out, I hired a lawyer to protect me from that and succeeded, and I'm happy that I did. I'm 76. I'm prepared to die at home should that happen. But there's a real issue with credibility. So if you talk to the educated patient today, and I'm not an anti-vaxxer, please, no, not at all, not at all. But what happened in the past 2 or 3 years proved to me what I learned from the 1970s. And there are many of us, very educated people, who have pulled away from the medical industry completely, except for acute, not just acute, but real crises. So I do want to know about public health, because there was a huge consensus around this in the past few years. What about their organizations, and what do they support? And how can a person who wants to be informed but safe trust in the credibility of even public health and the education that public health professionals are getting these days?
Well, I haven't researched that. I just know that, for example, the American Public Health Association has very little money, and 1 or 2, just a tiny handful of lobbyists. They're dependent on, teaming up with other lobbyists from other progressive, but they're just a tiny force, and I don't know how they're funding, but who funds them, but not very many fund them with not very much money. But I would add, on a personal note too, I'm 67, and medically was experiencing a lot that comes with that, mildly elevated blood pressure, PSA levels, cholesterol. And for example, I finally decided I'm not going to take statins. I know that it's the orthodoxy that takes statins for primary prevention. The fact of the matter is, I don't know, but I don't trust
Me neither.
the clinical practice guidelines about that. I mean, maybe if you've had a heart attack and you're at a high risk, then it makes sense. And the initial reason for recommending statins turned out to be wrong, I believe, according to the consensus, that it's the lipid effect causing hardening of the arteries. I'm just distrustful, not because not because I disbelieve that statins necessarily aren't good. It's just that I'm not sure I trust the orthodoxy because of the money coming to the American College of
Well,
Cardiology.
I agree with you. And to be honest with you, I said I'm 76. I'm not on any meds. I did everything through diet, and it's not only doing diet, it's changing and following every possible symptom. No meds. I
Well,
exercise.
so can I interrupt with maybe just one final thing? I guess we're running out of time. So here's a thought about I mean, and this is just something I'm speculating on. The American Heart Association, American College of Cardiology have a thing where you can plug in some numbers, your age, whatever your cholesterol levels and so forth, and to get a read on your likelihood of some event in the next 5 or what, I don't know, I don't remember, 10 years. And from what I gather, heart disease, the biggest cause of heart disease and other diseases, poverty, life conditions, and that's not part of the calculator. Maybe race is, I think maybe race is in there, and maybe that's a proxy for some of the public, health conditions that are cause of heart disease. But I look at that calculator and I think these cardiologists know the facts. But the calculator gives you a reading, and it doesn't take into account diet and exercise. And so the calculator tells me I should be on statins, and that's where I am. I'm decided I'm not buying that.
Okay, and we're running really short on time, but I noticed that we have a question from Mr. Oldani.
You have eight questions. Did you say 8 questions?
8, 1.
8 questions.
No, I'll just throw this out there, and maybe a medical student, or I know Adrian be interested. One area with these protocols and everything you're talking about, I'd love to see some more research on medical outcome specialists, medical science liaisons. Pharma's embedding PharmDs. They've hired PharmDs from our pharmacy school to get in there and do a lot of work. They have access to the data. They're grooming the markets for the more expensive products coming up behind after those outcome specialists get in there. So just food for thought. You're talking about protocols and those kinds of things. I think there's a deep level of infiltration now by these other specialists that are supposed to be firewalled and so on, but they're working directly with other pharmacists within hospital systems, insurance companies, that kind of thing.
So we have in the chat that Susan Saba wants to make a quick comment, I hope, because we are out of time.
Well, I'm a lawyer and I used to review documents for the pharmaceutical companies in Philadelphia, and I happened to work on a blockbuster statin case probably like 12 or 15 years ago. And I can tell you from reading the company's documents, I told myself I will never take a statin because the evidence showed that it has never prevented a heart attack. So that's my colloquial knowledge on statins. And then regarding, well, it's not colloquial. I mean, I read it in their documents, so whatever you want to call it. But and then regarding like the industries, I switched over to the plaintiff side. I did a lot of work on the opioids case, particularly the front groups. and a Robert Wood Johnson, who would have also been analyzed by the Senate Finance Committee. I think that was one of the earliest documents you sent. I mean, they were funding some of this stuff. You can't look at, I mean, people don't realize maybe that they're part of a nonprofit organization that is, basically peddling marketing concepts, but they do, do other innocent work. And I mean, I saw one of the opioids manufacturers who settled early, the email saying, look, we're not going to support this anymore. Like, these messages are not appropriate. So it's not black and white, the work of these nonprofit groups. But I will say, whenever I see a nonprofit job that I'm interested in, I follow the chain now to the annual reports and who pays for it, because very often it is going to be a corporation. So,
Well, if you send me something about statins, if you have something that might be of value and interest and use to me, because I will be writing about the American College of Cardiology in my book. So, and statins is one of the subjects among the.
Yeah, I mean, I would look at what the Cochrane Institute has as the clinical guidelines versus what the American Cardiology Group has. I don't have any of the documents from when I worked on that case, obviously, but I can Google and see if I can find some of the evidence that I saw, when I was looking at the internal documents.
I just read Peter Gutsch's book, Deadly Medicines and Organized Crime, which was deeply disturbing but impressively researched, and he even cast out. He was fired from Cochrane, and he even thinks that Cochrane is infiltrated somehow.
Oh, darn it!
I think Joanna Trimble can probably say something specifically to statins.
Yeah, I just put in the chat a little while ago a page from the NNT.org. So that is an organization that compares the number needed to treat to number needed to harm for various drugs. Anyway, I included the one on statins for primary prevention. And it's a real eye-opener, because really what it says is basically more harms than any good, benefits. And it doesn't ever really keep anyone from dying.
Yeah, I'm looking at that now, and that's basically what my takeaway message was from reading the company's research. What's saying here.
Well, if you send anything my way on anything related to medical societies, I'd be very happy to receive it and use it. I'm peter.swenson@yale.edu, and
Okay.
give me stuff to write about.
Okay, so I think we have to call a halt to this. I want to say that I think a lot of these kinds of discussions are going to continue at the Farmed Out annual meeting in a couple of months. So we had that in the chat as well. Peter, thank you for a very provocative and informative seminar. It's been great working with you over the last several weeks to make this happen. I know you're a busy person. Sophie, thank you for stepping up at the last minute to moderate this talk. I'll be sending you an email about a prompt for discussion board. Thanks to a great and active outside audience. And we'll see most of you next week, where we'll have a talk by John Hoberman about some aspects of race in medicine. So with that, thanks again and take care.
Thank you so much.
Hi, thank you.
Thank